So if you're new to the channel, welcome. If you've been to the channel before, then welcome back. Today I would like to discuss a procedure which has become quite popular in terms of inquiries and surgery over the last 12 months. The procedure we are going to discuss today is buccal fat removal. The buccal fat is a portion of fat which sits at the midpoint of the cheek, more or less halfway between the cheekbone and the jawline. It serves as padding between two important muscular layers, one layer inside the mouth being called the buccinator and the layer outside being called the masseter. It sits in its own specific pouch and has no function that we know of. There are no other structures that sit within this pouch, and essentially all it does is add padding and create shape and volume to the lower portion of the mid-face. We often see patients who come asking if they could have better defined cheekbones, a slimmer face, or if it's possible to achieve a more angled lower face with better defined proportions. We also see patients who believe their mid-face is a little wide and hamster-like, and they would like to see some more definition and exaggerate the prominence of their cheekbones. These patients have often independently looked up buccal fat removal and come and ask me about how it might help them. The consultation around buccal fat removal is based on some standard preoperative questions, namely, how is your health? Do you take medications? Do you have any allergies to medications that would preclude safe surgery? Do you have any history of facial cosmetic surgery or non-surgical interventions? Often these patients have tried filler in multiple different areas to either exaggerate their jawline, exaggerate their cheekbone line, or to strengthen their jawline. As an aside, may I please say that filler along the jawline is almost always a terrible idea. All it does is bring lumpiness and a boxiness to the lower third of the face, which is unlikely to give a pleasing aesthetic result in young patients and is highly likely to exaggerate a squared off look in patients in their 40s and over. Specifically, we will ask you about what goals you are hoping to achieve. Are you aiming for a more defined mid-face, or is there something more fundamental about your facial shape that you would like to change? Other things that are relevant to buccal fat removal are the type of work that you do, whether you can take a small amount of time off for the surgery, whether you have any specific sporting or gym activities. The examination of buccal fat is a little tricky. Unfortunately, the amount present is variable. There is no easy test that we can do in the clinic or outpatient setting to demonstrate how much buccal fat there might be. This therefore creates a problem because we don't know how much buccal fat removal will make a change or difference to your face. Buccal fat removal is only likely to give a slimmer, more athletic, defined mid-cheek area. It will not change any other aspects of your facial morphology. In terms of the surgery, buccal fat removal is something we can perform under local anaesthetic in an outpatient setting. The actual procedure only takes 20 to 30 minutes. The process involves signing a consent form, which suggests you accept the risks associated with any type of surgery. We will take photos. We will prep the inside of the mouth with a little bit of mouthwash. We inject a small amount of local anaesthetic with adrenaline into each cheek, just below the opening of the salivary duct inside the mouth. Through this small incision, we can bluntly dissect through the buccinator muscle into the pouch where the buccal fat sits. The buccal fat, once identified, can be relatively easily removed without any pain or discomfort. The amount we can remove varies anywhere between the size of a sugar cube up to the size of a small plum. The incision inside the mouth is stitched with dissolving stitch material. Mouthwash is given again, a little bit like the dentist, and then the patient is encouraged to take it easy for the next 48 hours. Try not to eat anything that's particularly big or chewy. as this will be uncomfortable inside the mouth. We also suggest to patients that they may inadvertently bite the inside of the mouth where the stitch material is. The stitch material is dissolving and so doesn't need removing. In terms of the immediate post-operative effects, the patient is likely to see a small improvement straight away. There will be some swelling and some numbness inside the mouth around the incision, but these very typically fade after a week or so. The key consideration when planning buccal fat removal surgery is it is almost impossible to tell how much of a difference the face shape will experience following buccal fat removal. As we mentioned, the amount that can be removed is variable between patients. The face shape is formed through bony anatomy, muscular anatomy, skin, and probably to the least degree, the buccal fat volume. In my experience, making a 20 to 30% difference in the overall width of the lower mid-face is as much as you can hope for. As long as we tell patients this before surgery, then it's something they can come to accept. Having said that, the vast majority of patients find buccal fat removal a simple, not particularly unpleasant, and relatively satisfactory operation with minimal downtime and a low complication profile. Very rarely we see infections from incisions inside the mouth. These usually are effectively treated with antibiotics. Structures that can be injured are the Stenson's duct, which is a salivary duct which opens just above the incision. There is a very small risk of injury to the nerves of the face. Bruising is unlikely as the buccal fat pouch is deep in the face, but it is not impossible. Follow-up typically involves reviewing the patient at 6 weeks and again at 3 months, where we can repeat photos and collectively assess how much difference removal of the fat has made. If you have any questions about buccal fat removal or how it might help you, then please get in touch with us here at adamgoodwinsurgery.com. The contact details are available at the end of the video. If you like this kind of content and would like to see more, then please hit the like and subscribe button. And if you have any comments or requests regarding future videos, then please let us know in the comments section below, and we will happily get back in touch and make any content that you would like to see.